Wellness for Life is brought to you by Sanford Health Clinic and Same-Day Surgery Center, Perham Area Community Center, Sally's Oils, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership.
Hi, I'm here today with Don at Pelican Drug Health Mart Pharmacies in Pelican Rapids. Don, I understand the deadline for applying for Medicare Part D is coming up soon. I have a question. What is Medicare Part D?
Medicare Part D covers prescription drugs. Medicare A and B do not, except in special instances, but that time period is October 15th through December 7th.
Okay. When can a person apply for Medicare Part D?
Once they turn 65, they have a time period of 3 months prior to the month they turn 65 and 3 months after when they can sign up for Medicare A, I believe A, B, and D.
Okay. Can you help people find a plan that works for them?
Yes, I have a computer program that will help me choose a plan for them.
Oh, great. Do you mind if we take a look?
Sure. We have a fictitious patient, Pelican Pete. Pelican Pete is on 5 different medicines. He's on Advair for his asthma, a generic Lipitor for his cholesterol, lorazepam for his anxiety, and losartan for his high blood pressure, and Novolog pen for his diabetes. What happens is when I load the patient's medicines into the computer program is it comes up with the plans that offer him the best price and it ranks them. So the top 3 plans are SilverScript, Medicare, and United American Essential. And you can see they're all pretty close to the same price. These prices include the cost of the drugs to him and his premium. So if he stays on the same medications for the year, this is basically what he'll end up paying out of pocket. We have the ability, because we know the medications that the doctor can switch to do a little research and find out what saves a patient money. Advair, there's other drugs that are like Advair that can be used. Another one we could change is the Novolog. We could change that out, and we could add Humalog. Once we replaced Novolog with Humalog, again, things changed. It dropped to $2,585, the total out-of-pocket expense, including premium for the year. So switching these two different drugs dropped the patient's cost by about $1,000 for the year. We can take and highlight 3 of the plans and compare them. And what we get is a plan that shows you month by month what they pay, including the premium. And as you can see on this one here, the Cigna Health Spring, this patient would pay $145 approximately a month for the first month. This one would pay $380, and this would pay $395. And that's because these 2 plans have a deductible. So if you want to have like an even monthly bill, if you can find a plan that doesn't require a deductible, it can take the bite out of that first month's drug bill.
After you help a patient find the plan that's best for them, can you help them with the enrollment process right here?
Yes, we can go right into the computer system. Allows us to apply or enroll a patient, if they choose the lowest one, or if they prefer a certain type of plan, or we can send the information to their agent if they work through an agent. Okay. So the option is up to the patient. It doesn't make any difference to us. Now, the system takes us right to the Medicare.gov website, and then we can fill out information that's pertinent to that patient, as if they were on the website themselves.
If you help a patient sign up for a plan, do they need to get their prescriptions through your pharmacy?
No, they don't. They can go to their preferred pharmacy.
Okay. Do you have any other advice for someone who is in the process of looking for a Medicare Part D plan right now?
I believe, they should try to get the best plan for them. It's more important to take your medicines regularly, and hopefully these plans will lower the cost and make it affordable for that patient. There's a lot of things that we would like to do to help them remember to take their medicines, or things like synchronizing the medicines so they all run out at the same time of each month. Most importantly, keep them out of the hospital.
Thank you for joining us today, and thank you, Don, for all of the valuable information about Medicare Part D. We'll see you next time.
Coming up on Wellness for Life.
Hello, I am here today with David Gottenborg of Gottenborg Chiropractic Clinic. David, could you tell us where your locations are?
Sure. I have two locations. The principal location is in Pelican Rapids. I've been here since 1983. The second location is in a small city east of us, Monaga, Minnesota. And I've been going there for about 20 years every Thursday.
Okay. I understand that this is just the first of many segments, and I would like if you could give us a little overview of what some of the topics that you're going to be covering will be.
Sure. Today I thought we would start off with something just really simple, and that's a basic introduction to chiropractic. And then I'm going to talk a little bit about the different techniques and how they vary between chiropractors. In the future, I'd like to talk about specific conditions like shoulder or low back pain, or how do we assess someone's health when they come in as a new patient.
Okay. I understand you have a video that we could watch that would help give us a better understanding of basic chiropractic care. Could we take a look at that now?
Sure, let's do it.
Chiropractic is based on the scientific fact that your nervous system controls the function of virtually every cell, tissue, organ, and system of your entire body. Bending, lifting, and turning depend upon the proper function of your nervous system, as does breathing, digestion, or fighting off an infection. Your nervous system controls everything. That's why your chiropractic doctor is so interested in your nervous system. Your body is controlled by the computer-like organ of the brain. The brain is protected by the skull and communicates with the tissues and organs of the body through the spinal cord, which is housed in the moving bones of the spinal column. Pairs of nerve roots branch off the spinal cord from between each spinal joint to service the entire body. A feedback loop back to the brain monitors the function of every tissue and organ. However, spinal bones can lose their normal motion or position due to trauma, repetitive motions, poor posture, emotional stress, drugs, alcohol, and many other causes. This can affect the nervous system control and function of associated organs and tissues. This is a common condition. Doctors of chiropractic refer to this as the vertebral subluxation complex, or more simply, a subluxation. The chiropractic approach to better health is to help normalize spinal structure and function, improve nervous system integrity, and allow your body to heal itself naturally.
David, I understand that different chiropractors use different techniques to help their patients. Could you explain to us some of those techniques?
Right. There may be more than 60 techniques, and yet I think most chiropractors will use 4 or 5 that are very, very common. So one of the methods is the chiropractor may actually make a quick thrust. And when they do this, sometimes it may shift or move gas within the joint, and the patient may or may not hear a pop. And sometimes the pop varies. Some chiropractors are trained in using an instrument like this called an activator that produces a precise, measurable force to make the adjustment. There are techniques that take advantage of the forces of gravity to help make the correction. And finally, techniques may vary to make the treatments comfortable and effective for newborns, young children, pregnant mothers, and seniors.
If I were someone who were having problems and I came into your clinic and had never had chiropractic care before, where would you begin with me?
After you've filled out the necessary paperwork, usually the exam or the visit begins with a questionnaire where I talk to you, and it basically ends up with us doing tests that are not uncommon to any doctor, where we're looking for the physical cause of pain. And then we end up doing tests that are more unique to chiropractors when we're looking for this subluxation, this misalignment.
Okay. Well, thank you very much for the information today, David. Thank you for joining us, and please join us again next time.
Thank you for watching Wellness for Life, brought to you by Sanford Health Clinic and Same Day Surgery Center, Area Community Center, Sally's Oils, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership,